Hi guys, just to share with you an interesting case that I was reading about just now. It's about Peutz Jeghers, which is a condition, an autosomal dominant condition, which affects a lot. Well, it's not very common, but it is a condition that it represents a crossover between dentistry and medicine. Dentists are supposed to be able to recognize the lesions once we see them around the mouth, and doctors are supposed to be able to recognize it because we know that the consequences of not recognizing it early can be fatal. So this autosomal dominant condition is actually found or as a result of STK11 mutations on chromosome 19. You classically see this with hyperpigmentation, as you can see in this patient and the one before. It's around the buccal mucosa, not buccal mucosa, the around the oral, the opening to the oral cavities. It looks like freckles. Sorry, not buccal mucosa. So, features of this condition, you have intestinal hematomas, usually affecting the small and large intestine. Now, why these are important is because they can actually bleed or lead to intussusception. As most surgeons already know, intussusception can result in need for an urgent laparotomy. So another thing this patient or persons with Peutz-Jeghers should be screened for is bowel cancers. Now, this condition is associated with things like breast, ovarian, colon. There's testicular, pancreatic cancers that are associated with this condition. So it's a very serious condition. I think there's even some association with gastric cancers as well too. So and cervical cancer. That there's also an association with this syndrome. So persons who have Peutz-Jeghers, especially females, should be screened as well too for cervical and ovarian cancer as well as breast cancer. So it is not an easy condition to have. You have to be screened every 3 years via colonoscopy or contrast examination, and at some point in time, many of these persons require some sort of surgery, whether it be or some procedure, whether it be a colonoscopy or, like I said, a contrast CT, contrast investigation. Now, with these conditions, you must not mix this up with smoker's melanosis, which is characterized by most times single hyperpigmented spot or macule on the lower lip. That's where the smoker rests their cigarette. So you can also see with smoker melanosis, you can actually see it in the soft palate, buccal mucosa. You can see it along basically any place in the mouth, the floor of the mouth, so, you name it. But once you see a freckle, you're supposed to check it out because, like I said, the consequences could be fatal. How management of this patient, like I said, there's surveillance. So every 3 years, these patients are supposed to be surveyed for things like colon cancers, gastric cancers, endoscopy straight through. Some surgeons elect to actually have, like for instance, if there is an emergency, what they'll do once they remove, like whether it be a polyp via endarterotomy or not endarterotomy, by enterotomy, sorry. Endarterotomy is something different. When they remove a polyp via enterotomy, they may actually elect to do what we call a surveillance of the entire bowel to make sure that there is nothing wrong with the bowel throughout. That's actually very, very prudent because it's better to see something directly in some instances. I hope this helps. Hope this gave you some idea. I hope that this helps with your reading. It's just kind of a crash course in Peutz Jeghers.